Hi gang, I'm Dr. Bill Sterett, and today we're once again going to talk about what's new and exciting in meniscus work. Everybody always asks about meniscus tears. Should they be repaired? Can they be repaired? What happens if they don't get repaired? So let's talk a little bit about the anatomy here. The meniscus is just this C-shaped ring of cushion that is between the femur and the tibia bones right here. So it's thicker on the periphery, thinner in the central aspect, acts like a little cup because of that, but is sponge-like. It really is a cushion for the knee. And it's the only cushion we have for our entire life, unfortunately, this one cushion. So we need to hold on to it as best we can. So at the smallest tear, people say, well, can't you just sew it up? And the answer is always, yeah, we can sew up anything. It's a matter of will your body be able to heal that. The peripheral aspect of this meniscus, meaning the outer half, is the only part that has good blood supply. And that actually wanes with age. As we're just 40 years old, we've lost about half of the blood supply to the meniscus. So fewer and fewer of them are amenable to repair. We can sew it up, but then if it doesn't heal, you're back in 6 months having the part trimmed up that didn't heal anyway. So that's the art of all this, making sure we're making the right decision about what can be repaired, what can't be repaired. So if we're repairing the meniscus, at least in my hands, it's because I feel that there's a really good chance that it can heal and that it's an important part of the cushion. There's no sense sewing it up and slowing down your rehabilitation if it's not an important part. But if we're sewing it up, it is because it's important, and I think it's got a good chance to heal. So what's the right risk of failure for you? And everybody's different. I've got people that have come in and say, well, if there's only a 20% chance of success, I still want it sewn up. For me, it's really good to put you through a longer rehabilitation recovery. It's got to be at least a 75% chance of success. If it's 50-50, I think trimming it up gets you back a little quicker, and it usually means it's not as important part of the cushion. But those are all discussions just to have with your surgeon at the time of your meniscus tear and what type of meniscus tear. There's another video just showing the 7 different types of meniscus tears and which one do you have: a flap, a bucket handle tear, a radial tear, root tear, things like that. Those all have different risk and benefit profiles from sewing it up. Sewing it up will increase your recovery time by more than double. So instead of 6 weeks, it's 3 months or 4 months. So you've got to incorporate that into your decision-making factor. We're not taking out parts that are providing cushion. The part that is torn is no longer providing cushion. If it's causing catching, locking, clicking, things like that, it's actually doing damage to your knee by flipping up in there, and instead of acting as a cushion, acting as like a little piece of sandpaper to that edge. If you're symptomatic with your meniscus tear, it's worthwhile getting it fixed, whether that means trimming or sewing. Both of those are fixing a meniscus. If it's asymptomatic, oftentimes you don't need anything. So lots and lots to talk about the meniscus. This is just an introductory thing. There's lots of great new things coming on board with stem cells and PRP adding to all this mixture, different types of implants to sew these together that are less invasive. Ask your surgeon about what type of tear you have, what are the chances of success, what are the changes in recovery if we sew it up versus don't sew it up, and make an informed decision. I'm Dr. Bill Sterett with another one of your Sports Medicine Minutes.